Hello, and welcome to Health and Fitness Redefined. I'm your host, Anthony Amen. Join me today as we take a dive into the world of health and fitness, where we learn how to overcome adversity, take back first fiction, and see health and fitness in a whole new light. I hope you guys are enjoying those quick tip episodes. We are in December. That is right, guys. We have officially hit the holiday season. So I hope you get all your shopping done. You're listening to some of our amazing episodes to really keep yourself on track, because this is the time of year a lot of people end up falling behind, and then they wait till after the new year and then go, oh darn, it's time to get back to the gym. Don't let that be you. Get back to your local gym, wherever that may be. Keep up your current exercise plan. Even if they cut back to 1 day a week, at least it's something. Don't start from scratch. It's a lot better that way. So without further ado, we're going to get into this week's episode. We had about 6 months ago a great guest on where him and I just talked all about concussions. That was Dr. Shane Stedman, and we really dove into concussions. So it was so much fun. We invited somebody else from his office who Dr. Shane told me is more knowledgeable than he is. So I'm really excited to have this guest on. We're going to have Dr. Perry. Dr. Perry, it is a pleasure to have you on today.
It is great to be here. Thank you for having me. I'm excited to chat about this topic.
Yeah, me too. It's studies of the brain and all that fun stuff. I guess it's a psychology degree inside of my head. It's like, ooh, this is fun. So I really get to pinpoint and kind of see how all of that works. But before we do that, I want to listen a little bit about yourself and how you got started working together with Dr. Shane. So take it away.
Yeah, definitely. So kind of where it all started. So in college, I played Division I football. So I played linebacker in college. I was a little bigger at the time. I've lost a little bit of weight. But I played football in college, and I was pre-med originally, so a biology degree with a neuroscience minor. And wasn't really quite sure what I wanted to do early on. I think typical college athlete, you're kind of all about the sport, and school's kind of like, I guess I kind of have to do this, but I really care about the sport. And the longer I was in it, the more I actually originally really enjoyed the rehab or manual therapy side of athletics. So actually originally I went to chiropractic school because I loved sports medicine. I loved like the hands-on, I loved the sports rehab. And then when I was in school, I got exposed to a gentleman named Ted Carrick out of the Carrick Institute, who is a functional neurologist who at the time had become really big because he was one of the main people who got Sidney Crosby back on the ice after his concussion. That's kind of where he got his claim to fame, was working with Sidney Crosby back in the day. And I kind of was listening to him. I was like, this is really cool, this idea of functional neurology. I never thought I'd be able to use my neuroscience background in what I'm doing now. So fast forward a few years, I finished up school. I went back and I did a diplomate in clinical neuroscience. So just like any specialty in medicine, healthcare, you can go back and get board certified. And I did in neurology. And then after that, did multiple fellowships in traumatic brain injury rehab and vestibular rehab. And kind of one of the big reasons that drew me to it was I had numerous teammates at the age of 25, 26 who were on disability, who were having seizures. So I was starting to see the ramifications of multiple concussions. And at the time, I remember going to trainers and saying, I've had a headache for like 4 months, and they'd be like, well, you're just getting used to hitting again. And I'd be like, yeah, you're right. I must be just getting used to my helmet again for the season. And I'd be, I joke with some patients I've had who are college football players now. And I was like, man, I remember popping ibuprofen like 4 every like 2 hours. Like you go up to the trainer and it was like, can I get a pack? And you just toss it down like candy. But at the time you don't know any better. And as I got older, I started to see like, wow, this is really having an effect. And even on myself, knock on wood, I consider myself somewhat making it out somewhat alive. Granted, I have my own issues, but that's part of the reason why I also got into this selfishly, is like, how do I figure out how when I'm 50, I know who I am? and that I can still have a family, I can still function, and so there is a selfish component along with it's just something that really fascinates and interests me and resonates with me. So that's kind of a quick backstory how I got into doing what I'm doing. I was working at a clinic in Portland, Oregon, Northwest Functional Neurology with a gentleman, Dr. Glenn Zielinski, who I think is one of the best. And so I had the privilege to do my residency up there, and then work up there for a little bit, and then actually almost moved out to Boston for a job at a concussion clinic. Most of my family's from Boston and New York, so I love visiting. But after being in Portland, Oregon, if you've ever lived there, it's very slow pace. And I was in Boston for 2 weeks, and I was like, I can't do this. It's too much. People are like driving in the shoulder lane, like passing. I was like, too much. So actually, I had met Dr. Stedman at a few conferences, and we were chatting, and it worked out. And I've been here for probably about 6, almost 7 years now. And we got a great clinic, and it's growing, and we're bringing on more practitioners. So it's pretty cool.
Well, I got to tell you, he had absolutely nothing but good things to say about you.
That is good. Yeah, he's funny, man. Sometimes we joke he's more of a cheerleader for me than I am myself. Like I actually have to joke with or talk to him sometimes where he'll chat with patients, and then he'll send them over to me, and he'll talk me up so highly where I'm sometimes like, hey man, I was like, don't put me up like that high. Like you're setting these expectations here. I don't know if I can, but it's like it's much better than the opposite. It's a good problem to have when your partner, the other doctor you work with, thinks so highly. So I have nothing but love and appreciation. But like I said, sometimes he sets expectations beyond what I sometimes think I can do, which is a good thing to have. So
yeah, definitely a good problem to have.
Yeah,
and we can kind of pick up the conversation there when it comes to just briefly your take. I know we did a whole episode on concussions, and he really dove into them, but it seems like that's really right up your alley too. Just dealing with it personally as a linebacker. My little story, just so you know, I've already had 4 in my life, 2 of them major concussions. So it's like we're trying to get back into it, and I understand the just headaches that just don't go away. So what's some advice you would give to somebody after having a minor or major concussion, or someone like ourselves who's had multiple at this point, where you're sitting here worried about CTE by the age of 50 and you don't want to remember who you are? So kind of walk us through that.
Yeah, so I guess maybe and if this is repeat, just stop me and I can move on. I think the important thing is to understand what kind of occurs with a concussion, because then we can better understand in the early phases what makes sense, but as moving forward also makes sense. So I always tell patients a few things happen with a concussion. One thing is that we know that there is a rotational force that occurs within the brain, right? So you don't have to hit your head to have a concussion. You just need a force to be transmitted either via your body or a sound wave. Take blast injuries from Iraq or from war. I've seen a lot of veterans with TBI secondary to blast injuries. Nothing hit their head, but literally the shock waves of an explosion gave them a traumatic brain injury. So there's some sort of rotational force. So like I tell people, there becomes shearing of these axonal connections. So within your brain, think of it as all these hubs and all these networks, right? And you have all these highways or like high-speed internet connecting them. And so when you get that shear force, you get kind of damage of those highway connections. So I always tell people, it's like you go from being high-speed internet to dial-up AOL, right? If you remember back in the day, like beep, boop, 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 right? So we know that these connections become skewed. Or another kind of analogy I like telling people, it's like those old World War II like phone boards, and it's like someone took the wiring and just mixed it all up. So a lot of times symptoms come from altered wiring within the brain, where hub A now doesn't communicate very well to hub B, right? It's like a bad game of telephone. And so all of a sudden your brain's like, wait, hold on. Why did my eyes just say that I was moving to the left? That doesn't match at all what my inner ear and my neck is saying, right? And that might equate to dizziness, neck pain, whatever it may be. So there is the structural component to a brain injury. And part of what we do is figuring out how can we quantify how those wires got rewired, and then how can we find ways to rewire them in a beneficial manner? So that's one piece. The other piece is that we know that concussions is just a metabolic mess, right? What I mean by that is that your brain cells go from being very fuel efficient, let's say getting 40 miles to the gallon, to getting 5 miles to the gallon. So we know one of the hallmarks is that neurons become very inefficient in the way they use glucose or sugar or carbs. And this is why in really serious brain injuries, people can develop like seizures or even second impact syndrome. Take Tua from the Dolphins, right? That was a prime example of his brain being primed so that a trivial whiplash from being thrown to the ground all of a sudden literally created posturing that you see when people are close to like brain dead, and so these neurons are now very unstable. So there's a fuel component, and then there also is changes in the immune system, right? And this is where some of the CTE comes into play. Is I always tell this analogy is like when your brain has a head injury, think of it as like a frat party, right? And you have these immune cells within the brain. They're called microglial cells, but they're like the janitor. So you throw this frat party, they turn on, they come in, they clean up the debris, and everything should be relatively okay. But if you keep having frat parties every weekend, eventually these janitors or these microglial cells will say, hey, I'm just going to stay on. You're always destroying this house. We got to come in and rebuild every weekend. We're just going to stay on. And this is what is a concept called microglial priming, where the pro-inflammatory immune system in the brain just literally does not turn off. So we should have a pro-inflammatory and an anti-inflammatory, and they should go back and forth. But what we see in states like CTE, Alzheimer's, Parkinson's, all of these neurodegenerative cases is that you have this microglial priming where these immune cells just don't turn off. And so that's kind of what happens with a head injury. So a few things. So going back to it, one is the whole concept of rest. Really, when you look at the research, rest is only supported for like the first 2 to 4 weeks. If symptoms are not resolving from that point on, the research supports that some sort of intervention needs to be made. So you need to see some sort of specialist who can understand where these symptoms are coming from. And every concussion is completely different. Every patient with dizziness after a head injury is very, very different. So it's very hard to have protocols for dizziness post-concussion. So I think finding appropriate help, and like if you're at 6 months and your doctor's still saying like, rest, or this is the best you're going to get, that is like farthest from the truth. We have patients years after head injuries who still can make tremendous benefits. So that's one piece. Another piece, I think early on, and this might be for a later time, but some things that people can think about early on with a head injury. So like we talked about is that metabolic cascade. So when the neurons become very inefficient, this is actually where sometimes things like ketogenic diets can be therapeutic sometimes early on in brain injury. So the brain loses its ability to really use glucose efficiently, but doesn't really lose its ability to use fat for fuel. So this is where sometimes we'll use things like ketogenic diets, or we'll use things like exogenous ketones. So liquid ketone esters that can literally get someone's ketone levels to that as if you've been fasting for 5 days, but within 30 minutes, to therapeutically try to stabilize energy early on to keep from worsening damage. Because the longer the brain is unstable, these are the people who are like, I go into work and I'm like fried in an hour, or I'm very sound, I'm very light, like they're very sensitive. Anything sets them off. And that's purely because their brain's got no energy. So that's something that people can look into. And then from a simple like supplement standpoint, without getting into nuances, because there's a lot of different things that we do, but safe things that are supported by research are things like omega-3s can be really helpful in dampening that microglial priming, specifically DHA. So when you look at fish oil, you have EPA and DHA. DHA at really high dosage has some really cool research in limiting that microglial priming. And then lastly, we get this hyperexcitability within neurons. And so actually using things like magnesium threonate or glycinate can be helpful early on in stabilizing those neuronal pools for becoming hyperexcitable. So those are like a few things, like tools that people have to explore. There's so much more that can be done, but these are some pretty safe, like research-based tools that even a lot of times I'll use myself. I do a lot of martial arts, and there's times I'll take a kick to the face. And of course, doing what I do, I'm like, I go into freak out mode. I'm like, oh God, what's going to happen? But I'll use some of these things where I may, start upping dosage of certain things to try to mitigate things early on so that this doesn't last very long. So, and we can always get into later of more tools and tactics, but those are some kind of tools where I think the biggest thing is like things can be done. When doctors say nothing can be done, you should probably go somewhere else. Or if they continue to tell you to rest, they really don't know, and they're really not following, evidence-based medicine, which really doesn't support that in the realm of concussions. We know that some sort of intervention needs to be done, some sort of rehab strategy needs to be started to start to fix the areas that have been disrupted in that individual's brain.
Yeah, and that was a huge answer. So I
sorry.
No, it's good. I didn't interrupt because I loved how you kind of just systematically and really talked about everything and worded it out, and it was very well done. And I was just thinking like, oh, this is what Shane was talking about. So that was an awesome answer. And coming from somebody who kind of went through that protocol, and I know you could talk from experience, I had that over and over and over again. It was, oh, just rest. Oh, you're fine. Oh, it's nothing. It's in your head. It's this, it's that. And that was a week after, 6 months after, 6 years after, people still just kind of dismissed it. God, it's normal. Get used to it. You're never going to change. This is kind of your status quo from now on. But we've shown that there's ways to kind of go about and get over it. And that was a better answer of things I personally wish I knew back when I was 20, because then maybe I would have less long-term effects of a concussion than what I have now. But I gotta say, there's definitely ways to help. And I want to bring up a point of exercise, because this is how I helped mine. Mine was more, and I know you said every concussion is different, and it's so true. Mine was more of a spinal injury because I fell backwards on ice and knocked my neck straight. So that triggered muscle spasms called tension migraines. And that on top of the light sensitivity and all that fun stuff from hitting the back of your head. Is there anything different when it comes to spinal injuries as there are with concussions that maybe the front of the head or the side of the head?
Yeah, that's actually a really interesting point. And I'm going to speak a little bit more to like whiplash injuries, which is a spine injury versus like a spinal cord per se. What's really crazy about like whiplash injuries is they can also produce concussions, but they also can look just like concussions, right? And there's this whole concept that some people talk about of where whiplash injuries look like concussions, and sometimes you treat the whiplash and all of a sudden everything dissipates. And, I think when I first started, it's funny, this is funny coming from a chiropractic background, I kind of discounted the neck and the cervical spine. And the longer I've been in practice treating patients, I'm like, man, necks are so important when it comes to concussions and whiplash. You start to realize that the neck or the cervical spine is so integrated with all other sensory systems within the body, especially vision and in your inner ear. So concussions, it's very common that there becomes disruption in the communication between your neck, your inner ear, and your eyes. And why that can be so detrimental is that those three systems are literally what lets you know where you are in the world. They tell you where your head is in space, and they tell you where your body is relative. The amount of like weird movement disorders or like tremors that I've seen secondary to whiplash injuries, like a neck injury, and all of a sudden someone's, their hand shaking or their arm spontaneously moving, is a lot, and you fix the neck and those things go away or they get significantly better. So yeah, those things really are connected, and it's not uncommon to see, so if we think about it within the brain, input from muscles in my neck, the joint. So within my joint, I have what are called mechanoreceptors. So receptors that let me know like my vertebra are left, right, they're tilting. That feeds up into my brain, into a center within my brainstem, which is the lower part of my brain. And then my inner ear, who's measuring gravity, that feeds in along with vision, and they all come into the same hub. And then those volley up to other areas where they say, okay, do these make sense? Are these matching up? And so you can have a neck injury that feeds into that, and then it skews the output, right? Just like a game of telephone, or if you've ever played the game Telestrations, where you write a word, you draw, and then you get to the end and you're like, how did you get like cat from pool? Like what? How did you get there? And that's what can happen, where the neck can actually skew the way the brain is processing the world. So the brain could actually be fine physiologically, but you have what's called like a sensory mismatch. And that sensory mismatch can wreak havoc. And so that can create neck spasms, because think of it as like not like a fine-tuned radio, where the feedback coming from the neck is like static radio station. And so then your ability to control something, no different than like when you sit on your hand and it goes numb, when you move it, it's all uncoordinated, right? You need sensory information to create motor output. Right? If you can't feel something, how can you control it? So if you don't have good input from your neck, it's not uncommon to see like muscle spasms leading to headaches, but then to also see altered eye tracking, and then dizziness, anxiety, all these other symptoms manifest from a simple like spine injury or whiplash injury. So that's very common to see, and it's very overlooked. And I think this is honestly too, where you have a lot of manual therapists, chiros, PT, massage therapists, sometimes who not to rag, but sometimes have these miracle cases and they don't really know why, because the neck is so integrated. How many people are like, I went to the chiro, I got my neck adjusted, I went to the PT and they, worked on my neck and like all my concussion symptoms got way better. But the problem is, therefore, they think everyone needs that, which is not the case. We have to understand when people need that appropriate treatment. But yeah, the neck is very, very integral in looking like a concussion, but also with concussions as well.
Yeah, it's pretty crazy. Just kind of as you're talking about it, I'm like going back, like, yeah, it was just so different. Because I've had straight out ones too, and that was just like, it was a lot different put on top of each other. So very, very interesting, kind of how the neck controls everything. And I think another point, and correct me if I'm wrong, but most of the nerves go down the spinal column and travel through the cervical spine. So
yeah, no, you're totally
on those.
Yeah, you're totally correct. I mean, so if we think about that, like if we were to have a true spinal cord injury, let's say, yeah, you'd be paralyzed from the neck down. So you have all the information going to your arms, your trunk, your leg. So yeah, you can sometimes have like spinal cord concussions or contusions where it's not like fully damaged, but your spinal cord itself actually gets a concussion. And yeah, that's all the sensory information, and that's all the motor information going to everything from that segment down. So it's a pretty important area, which is funny, being that I do a lot of jujitsu. Sometimes I'm like, this is not the best thing for my neck. I don't know why I do it. It's fun, but I sometimes is like, oh God, like as long as it's like from here down, just I got to protect this above. All other things heal, and they heal easy. Shoulders, knees, and stuff like that. So
it's almost like you get into a fight on the street and you're like, all right, no face. It's like Anchorman. That was the funniest freaking fight scene ever. Of course, no hair.
Yeah, that's hilarious. It's so true.
But that's funny. I'm going to take a quick break from a word from our sponsor, guys. And I promise we're going to move on to different neurological disorders. We're going to talk about inner ear imbalances and all that different stuff that you may have. Dr. Perry has awesome ideas. I'm really excited to hear it. So we'll take a quick break and we'll be right back. See you on the flip. For us, we know what it's like to feel unhealthy, depressed, and downright defeated. We want to show others there is a right way, and through fitness, you can do anything you set your mind to. Fitness can give you that motivation, confidence, energy you need to bridge that mental gap and prevent you from missing important life events. We understand it's about feeling better, living longer, and being good examples for our kids. We understand this because we live it. And for us, that's the redefined difference. Hey everybody, and welcome back. We have Dr. Perry on. We did the first half on concussion, so now we're going to move on because there's a lot of other things that people experience, and I kind of want to see your take on them. And I want to start with the inner ear and most importantly, vertigo, because that's something a lot of people do have as far as clients coming in. And as a trainer, it's learning how to train somebody with vertigo, which is different because you have to be careful what you're doing and how it affects their balance and their proprioception. So what are some things someone can do if they suffer from vertigo or are known to have certain triggers for it? What's your take on that? Go for it.
Yeah. So I think going back to what I kind of mentioned earlier, it really is important to find someone who understands those things, because you'd be surprised how a lot of people, I don't like people to have to deal with things. I would rather fix it if I could, or get people to where they can function. Now, do I have patients who have to deal, but these are like really complicated patients where people's immune system are destroying their inner ear. But most people with dizziness or vertigo, they get forced to kind of manage because they get mismanaged. If you look at, so if we think about dizziness just as a concept, a majority of the time, dizziness is just a sensory mismatch, right? It's no different than car sickness. If you're reading a book in a car, one of the reasons you get dizzy is because your vision says you're not moving and your inner ear says you are moving. And so those two signals don't really match. And so then you might get nauseous or you might feel dizzy. So when someone's dizzy, really the key is figuring out where is their mismatch and why don't they understand where their head is in the world. I'd say 70% of the time, that is what's playing a role in someone's dizziness. There's some other outliers we may talk about, but majority of the time it's that. So we have to ask ourselves, is it the inner ear itself, right? Because my inner ear does kind of two things. It measures velocity signals. So as I turn my head around, I have sensors that detect fluid motion that say you're moving your head at 500 degrees per second. And then I have other sensors in my inner ear that understand static position. So they let me know my head's neutral, it's tilting, it's forward, right? And those sensors merge sensory within my brain to give me a map of where my head is in gravity. And that's layered on top of my cervical spine or my neck, saying, where's my head? And then my vision gives me what I call a world reference frame. Where is the world in reference to me? Your inner ear and your neck give you the longitude, latitude, where you are in the map. Your vision now says, off of that longitude, latitude, here's the water bottle in front of me. So I can go and grab that water bottle. So we need to figure out, where is that mismatch coming from? Is it coming from the vision? Is it coming from the neck? Or is it coming from the inner ear? Or is it the areas of the brain just are not interpreting it very well, right? So the TV repair shop is just not really fixing these systems very well. So really it's important to figure out where the mismatch is, because then we can create appropriate therapies to get it to where an individual hopefully doesn't have to manage, but can function at a high level, So that might be something like vision therapy, or that may be things like vestibular rehab, where we're retraining the sensors in the inner ear to work a little bit better. Or maybe it is work on the neck. Maybe it is manual therapy. Maybe it's massage, PT, chiro, dry needling, all of these different things, to get rid of that mismatch. And when you can sometimes find that, it's not uncommon where you can sometimes look like a miracle worker, where you can take someone with debilitating dizziness and in a matter of 30 minutes, an hour, all of a sudden get it to resolve, because it's literally as simple as like, find the mismatch, clear it up. And all of a sudden people are like, holy crap, like I feel way more grounded. So I think that's the big piece, is finding specifically a functional neurologist, because I think functional neurologists are some of the best of understanding vision, inner ear, all those things together, because you do have like vestibular rehab PTs. They're great, but it's all inner ear. And you may have a vision therapist or a neurooptometrist, so an eye doctor, but everything's vision to them. And then maybe a chiro or PT massage, everything's structural. And so you need someone who really understands all of those to put that together. So that's, I think, a really big piece. And I think the other advice I have is that, going back to like, if someone is telling you, if someone hasn't even like examined you, like touched you, done tests, and they're literally just talking to you and they say like, no, sorry, you're just going to have to manage. It's like, BS. How do you know that? Like, you haven't done anything to show what's wrong, So we really like to test these things functionally to see, to then create a strategy. So that's my biggest advice, because I think little tidbits of how to help people depends on what's going on. Like prime example being, let's say there is a whiplash injury. That's where things like sometimes neck strengthening can be really beneficial for that person's dizziness. Or I love things like taping. So like rock tape, K tape, dynamic tape. That can be super helpful when the dizziness is cervicogenic or neck in nature. I think a big piece I think works for everyone, let's say, is whether any three of those things are messed up. Or I always tell my older clients or patients this is like, you have to keep the rest of your body strong. So going back to is that we have redundancy in the system so that if one goes down, I can manage, right? But what if I have numb feet, weak hips, my inner ear doesn't work, and I have cataracts? I'm kind of not in a good position where my vision doesn't work, my inner ear doesn't work, and my proprioceptive system is not good. So I really harp with everyone, like, it is not going to hurt to make your proprioceptive system as ideal as possible. That is, strengthen the feet, coordination of the feet, strong hips, strong core. Like, the better your everything from your neck down can stabilize you, the more that's going to let you get by with faulty systems elsewhere. So I think, everything you're kind of chatting about and do with individuals, like for most people with dizziness, those things can be very therapeutic because it gives them an alternative system for another system that's not working. Like, especially the feet, people neglect their feet, and your feet are literally what connects you to the earth below you. We do a ton of work with people's feet, ton of electrical stimulation, a ton of retraining, motor control, and we connect that to the inner ear. But foot training and connection of the foot to the hip is crazy important in patients with dizziness and balance disorders.
Yeah, and I'm just laughing because a lot of the times people are always asking us, why are we doing these silly exercises? And I'm just like, it's proprioception training.
Mm-hmm.
And they go, why do I need that? And you're trying to explain it's like teaching your body where it is in space. So like a lot of the times we're just trying to make games out of it so people find it a little less boring. But if you guys want to do a really quick proprioception test at home to see how good you are, really simple. All you do is you can put this on pause, and obviously don't do this while you're driving, but stand up and stand on one leg, whatever leg you want. Doesn't matter. Now, what first thing you're going to notice is that if you start looking around the room and standing on one leg, it's going to be very hard to balance, because that means your body is very heavily using visual feedback for its proprioception. And once your eyes are determining where you are in space and how you're standing. Now, if you take and find something in front of you on the floor, let's say roughly 6 to 8 feet, regardless of what it is, and you stare at a focal point, your body can use that to say, hey, that's not moving, therefore I'm not moving, and it's a lot easier for you then to balance at that point. Now, if you want to take this a step further, especially for athletes, it's something we do all the time, close your eyes, because now you get rid of that visual cue, and you're going to realize most people can't even stand on one leg with their eyes closed. It's not happening. But for an athlete who, let's say a baseball player is at home base and he's getting ready to hit, there's no way he can track the ball, track the bat, track where he wants to hit it, track what the pitcher's doing, track what the field's doing, all within, how fast does a ball get to home plate? Like
92. Yeah, I don't know. Moving at 90 to 100 miles per hour.
It's something absolutely crazy. There's no way you can do those 5 things, especially like make sure my hands are back here, make sure my feet are pivot. So it's training in proprioception and not getting rid of the dependency of your eyes. So it's a lot easier just to focus on what you need to see in that given moment, those variables outside of yourself. So that's my quick little spew of proprioception training, and hopefully people understand a little more about why we do little things like that, especially those that suffer from any kind of vertigo or any kind of head injury, to really help kind of center themselves again. Of course, we start easy and work our way up. But what's your take on the fitness side of it as far as that goes?
In regards to kind of what you chat about, or just like exercise in general for some of these things?
Oh,
Okay, yeah. I mean, I think what you just brought up I think is great, and it's brilliant. I mean, we do very similar testing to that all the time. Like you said, it's like you have to see how individuals are reweighting dependency of sensory systems within their brain. And it's not uncommon when people suffer vertigo, they become very visually dominant. And this leads to a lot of motion sensitivity. Like I go to the grocery store and I don't like it, or I'm very motion sick in a car. And so part of it is not only fixing the inner ear, it's down regulating and decreasing their dependency on vision and improving their dependency on other systems. And you said it perfectly. That may be doing a lot of things in eyes closed or darkness where you're forcing your brain, hey, sorry, I'm not going to give you vision. Figure it out with another sensory system to decrease dependency. So I think the things you said are spot on, and I love it. Exercise, it's funny. Over the last year, I've become a little more bullish on the concept of exercise in a beneficial manner where it's powerful, and it's very powerful in neurological rehabilitation. We know that post-concussive symptoms lasting multiple months, they have a similar mechanism, and that mechanism is altered cerebral blood flow. So inability to efficiently get blood into the brain. And what's really cool is that exercise is really powerful in reinstituting that ability to regulate blood flow in the brain. Specifically, what's called like ventilation threshold exercise. So kind of like your typical like zone 2 training, or like a pace where you can have a conversation, you're kind of right at that line. What's really cool about that in the research is that it optimizes blood flow velocity to the brain. Once you go above that into more high intensity, and this is not to say high intensity is not good, it is good, but from a brain injury standpoint, I like a little bit lower threshold. You actually start to diminish blood flow velocity, and that's because of CO2 build up because of the intensity of exercise. But I've started more and more really emphasizing exercise, and it's important because I think so many doctors say, yeah, go exercise. But so many patients are like, what does that mean? Like I take for granted that I've played athletics my whole life and exercise makes a lot of sense. Like I'm knowledgeable in that I just enjoy it and I find it very interesting. So to me, it's like, it can make sense, but you forget that most people have no clue what they're doing. They're like, I don't know what that means. Do I just go like walk on a treadmill? Do I go sprint? So I've really tried over the past year to really start to actually like almost like program for people, not to the extent that that other individuals do, but actually giving patients understandable tools of how they can use physical exercise as medicine. And I think resistance training is its own beast that like, if you don't stay strong, especially once again, going from a balance standpoint, if you're going into your later decade, your 60s, your 70s, your 80s, and you are not prioritizing strength training, you're going to be in for a rude awakening when all of a sudden your balance starts to go, because once again, everything up here is slowly degrading. It's like you have to keep muscle strong. You have to keep coordinated. Like honestly, right now, I'm in my 30s. I'm like, I have to keep muscle mass as high as I can, because I know at a certain point it's going to start to diminish. So I want to go into my later decades as big and as strong as I can so that I have those reserves. So I think strength training is really important from a keeping a lean muscle mass, which has so many benefits that we don't have time to talk about today. But I love aerobic training for reintegrating blood flow into the brain. It can be so powerful in improving so many post-concussive symptoms. So I love exercise and concussions. I really do think it is medicine for concussions if done appropriately.
You just stole our whole slogan. You'll hear it at the end, but that's what we always say: fitness is medicine, because I truly believe it is. It's kind of what gave in, specifically the resistance training part of the anaerobic side of it, where you're staying in those shorter, like you called it, stage 2 of what you are as far as how quick your heart rate's going, either doing the perceived exertion or going based upon your max heart rate percentage. But it's like right at that point, you're able to like, yeah, how's it going? Doing all right. a little bit. And you kind of hear that like half-winded. That's an easy way to tell kind of if you're at that 50-60% of your max, as opposed to being like, yeah, whatever you say. Like that, we're up in like 80, 90. So that's why us as trainers are constantly, we're chatterboxes.
Oh, that's funny. That's a good point. I never actually thought about that, but that totally makes sense.
Oh yeah, I'm talking about everything. I want to keep you talking because that's how, in my head, I'm tracking where your heart rate is.
I love it.
I'm not an equipped medical facility where everyone has like the heart rates on my watch and I'm able to watch it and I know where their maxes are and everything. So I'm just back to old school, just chatting with you about life. And doing it, I mean, I love talking to people, don't get me wrong, but the double-edged side of that is now I get to see kind of where you're at and help with our programming.
Yeah.
So it's a win-win on getting that no clients, get personal with them, which is an amazing part of what we do, and then also track heart rate on top of it. So really interesting food for thought. We really dove into this topic. So I'm going to be I want brief. I want like 30 seconds. This is your bulleted points of of a couple quick little topics, like a rapid fire point.
Perfect.
You ready?
Let's do it.
Let's start with dementia. Top 3 things you do. Go.
Top 3 things is exercise. So going back to is like exercise is a potent protector of the brain. So everything we just talked about, nutrition. We could do a whole segment on that, but really dialing in diet and exercise is super, super, super important. And the last one I would say is stay engaged. Have something that you have a passion about. Keep the brain active. I think when you see people retire, that's when their brain starts to go down. So I think have a purpose, have a passion, and literally keep your brain active. So exercise, diet, having a purpose, and keeping your brain engaged for as long as you can.
I'm going to keep it easy and hop into the one that's similar. Alzheimer's.
Yeah, I mean, I think all of those, same things can feed into that. I think I'm going to give a shout out to keep it short, a gentleman called Dale Bredesen. He has summarized this topic really well. He's got a book called The End of Alzheimer's, and he takes so much information, and he has this concept called a cognoscopy, which I think is brilliant, and we do with patients, where it looks at all the metabolic factors that can predispose you to Alzheimer's. This is all done through blood work. You layer that on top of functional imaging of the brain, cognitive assessment, so you can literally figure out where the holes are kind of in your brain that may lead you or predispose you, so you can create a custom plan to kind of go after those. So I'm just going to tell people, look at the name Dale Bredesen, look at his work, End of Alzheimer's. If you're curious about that topic, it's a phenomenal book, and he's got a ton of great content on that topic.
Get him on to talk about that, because that's a big one. A lot of people, like, everyone knows someone suffering. Like my grandmother personally, it's a tough.
We could spend hours and hours in a weekend and not even scratch the surface.
Yeah, totally agree. And another one that's a huge topic, PTSD.
Yeah, I think I'm going to keep it on kind of like some cool new things. I think I was talking to a patient the other day. There is some cool things beyond medications. There's some cool, so there's things like ketamine. This comes into some of like the psychedelic assisted therapy, which I think is really cool. So, you have John Hopkins doing some of that, but I've seen a lot of success with ketamine, which is a drug that sometimes people will use in PTSD. So I think that's really cool. And then there's some really cool devices. So vagal nerve stimulation. We have a few medical devices. And then also what's called stellate ganglion blocks. So these are some kind of cool, new, trendy medical invasive and non-invasive procedures that can be helpful in resetting that fight or flight, right? And I want to give options that are different than just medication. Of course, we know that counseling, therapy, cognitive behavioral therapy, those things are really important, but these are some other cool things. I think psychedelics are going to start to be a really cool area in helping, right? Because they really help your brain enter some of that trauma and allow you to start to recontextualize that trauma to de-escalate the threat. Because that's really what we want to do, is we want to take a threat response and we want to recontextualize it and de-escalate it. So I think the psychedelics are a cool arena, need to be done with a professional. Things like vagal nerve stimulators and stellate ganglion blocks are things to be on the lookout of, some kind of new ways of managing and treating PTSD.
Yeah, we did a whole episode on psychedelics, and how it kind of can affect with PTSD. It was very, very, very interesting. But I'm going to totally agree with you on what you said. Do it with a professional, and I know it's more about microdosing than it is about taking an obscene amount for a party, because that's never good for anybody.
Yeah, Dr. Maynard did not say go to an EDM festival and trip, and he said I did not say that.
He means take so little that you barely feel the effect of it.
I think the important thing is having someone to help you process it. And some individuals are purposeful and they journal, but I think having a medical professional that can guide you through the journey is what changes it, because you're literally opening up a window to rewire your brain. And if you're not ready to do that, it can go the opposite way. So don't get it twisted. It can be amazing for PTSD, but you can also create trauma and PTSD around it as well. So you got to be very careful.
Yeah, definitely. And I'm going to throw a wild card in there. I'm going to let you pick one, something that you see common.
Ooh, yeah. Okay. Okay, this is going to be maybe not what you're expecting. I think having and maintaining support systems. One of the biggest things I see in all of my population that really determines outcome, two things I should say actually: support system and outlook. The individuals who get better, I can now usually tell within my first interaction. Individuals who let their condition define them is a very dangerous narrative. And those are the people that I really sometimes look at. I'm like, I don't know if you're going to get better. Versus the individuals who have the mindset, who they don't let their condition define them, and they continue to contribute into the world the best they can. They continue to try to go to work, exercise, kind of that fighting mentality. It's silly, but it's so important. As soon as people start to recluse, not hang out with their friends, say, this is who I am, this is me, I am this condition, that's a very dangerous narrative. So that's a huge thing I would tell people, is mindset is everything. And then having a support system. When people have caring parents or a spouse or a friend, it just has to be somebody. Support system is so important when you're suffering, but when you're not suffering. Once again, having community and being able to engage. When you look at places like the blue zones, where you have the highest amount of centenarians or people that live the longest, they have amazing communities. They have communities going into the later stages of their life. They have support systems. Even if it's simply just like a book club, it's something where you can go and you can engage with others. I know it's maybe not the sexiest hack, but it's what I see be the difference in people getting well and people remaining sick.
I'm going to put one point on this before we wrap up. And I know it's morbid, but we have to think about it. I can't, being my wife is a nurse and works with very sick neuro ICR population all the time. And being from what I've seen personally and talked to people personally, when we die, and I'm not talking about random accidents that kill us. I mean, getting old and are at that point that we're ready to move on. It's a conscious decision that makes us move on. And what I mean by that is you will see it. And my great grandfather, for example, made it very clear. I want to make it to the millennial and then I'm done. And literally 3 days later, he passed away after the turn of the century. So my point being, millennial century, whatever. So my point being, like, we have this capability that when we want something, we reach out longer for it. So another side is when you get older and all your friends die, all the people you hang out with die, and now you're kind of by yourself, it gets depressing. So you go, okay, I'm ready to move on. But if you had a support system and you had people with you and you had people engaging with you and you had things to look forward to, it keeps you alive longer
Mhm.
if you want to. And in the hospital, so many times, my wife would tell me that patients would tell her, like, after my family leaves the room, I'm moving on. I don't want to die in front of them because they want me here, but I'm ready to go. And literally, the family would leave the room and they would die 5 minutes later. It's chilling to the bone, like how it's a conscious decision for people just to kind of move on. But on the flip side, it's a conscious decision for people to keep moving forward and keep striving to get better, to not take an answer and think it's the end of your life, you're going to be paralyzed. If I got hit in the head and I was like telling myself, I'm never going to get better and I'm going to have all these symptoms now, I'm eventually going to have those symptoms because my brain's going to form them. It's this crazy placebo effect that we have on ourselves, that we can force symptoms and that we wouldn't normally have from something. Or on the flip side, if I said, hey, I'm going to get better, I'm going to be past this, I'm going to have a group that's going to help me, I'm going to get past it, and I'm going to be holding on, and I'm going to do the best to contribute and live a happier, longer life than I would in the short term.
You nailed it. I think that's a really key point. It's no different when you look at cancer patients, and it's like you got a year to live. And you sometimes wonder, you're like, is that the best? Or sometimes people, change. I've noticed this with my own father, who's been battling with pancreatic cancer. I think that him continuing to work and provide and have purpose is one of the reasons he is still with us. Is that he literally, like, there's times that like I'm complaining and this dude is like working 70-hour work weeks. I'm like, I really have no reason to complain. Like, but I think that's what keeps him going. And that's the reason, versus I've seen other family members with similar diagnosis crawl into the bed and it's over at that point. So I think what you said is so true. And it's beautiful and scary all at the same time. But the power of the mind and the power of loved ones and support staff it goes beyond what we can really quantify and understand.
Yeah. And Perry, let's wrap this up. So final two questions I ask everybody. Summarize this episode in 1 or 2 sentences. What would be your take-home message?
Yeah. If you are suffering from concussions specifically, or let's say vertigo, do not give up hope. And there are plenty of individuals and practitioners around the country who really understand these to get you better. So don't take the just continue to rest. Continue to push and find a provider to get better, because it is possible.
Love it. And then second question, easiest fall, how can people find you, get a hold of you, all that fun stuff?
Yep. So you can follow me on social media. So Dr. Perry Maynard on Instagram and Facebook. And then our website, integratedhealthdenver.com. We have a ton of podcast links. We have access to a ton of webinars. So we do a ton of webinars on all these topics that we just talked about, but like in great detail. So if you're wanting to get more nitty gritty on concussions, we have tons of content there. And then also that's where you can contact us. So we offer free 30-minute consultations with individuals to either see if we think we'd be a good fit, or find them providers. I talk to people on the East Coast all the time, and I got friends in Boston, New York. So it's an opportunity where I can say, hey, let me link you up with a great practitioner in New Hampshire, in Boston, in New York. So we offer those, and I think those are super helpful in helping to guide people around the country.
I love it. Dr. Perry, thank you for coming on, and thank you for joining us on this week's episode of Health and Fitness Redefined. Don't forget, hit that subscribe button and join us next week as we dive deeper into this ever-changing field. And like we said before, and remember, fitness is medicine. Until next time.